Hi, everybody. Assalamualaikum. Am I audible? Assalamualaikum.
Yes, Faiza, some people are joining right now, so you can wait for 1 minute and then can start. Yeah.
Okay, sir. What, sir? Assalamualaikum, sir. Am I audible?
Yes, you can start now. Yeah.
Thank you. On behalf of Fatima Hope for Peace and Psychological Center, the organization of students with motto to spread positivity and hope, not only among the students in society, but also in the society. Good evening and very warm welcome to all ladies and gentlemen. Let me begin by welcoming all of you to today's event and thank you for selecting me for this introductory part. It's a great honor for me to host this workshop on. This is the subject in which we should all be deeply interested, the research, qualitative research. Our worthy speakers, Dr. Mr. Mujib and Dr. Ms. Karen Qualls, have spent almost their complete career advising people on this most wanted topic. Mr. Masood and Ms. Karen Qualls are currently part of the University of New York. I feel elated to introduce our worthy guest tonight in this venue. Now I request our worthy guest speaker, Mr. Masood, to share his knowledge with audience. I request you all to keep your mic mute. Any query about this topic shall be answered in the end of the discussion. Hope this webinar is going to be very informative to all of you. Thank you for joining us. Over to you, sir. Thank you.
Yeah, thank you very much, Faiza. So, very warm welcome to everybody. And just few corrections that myself and Karen hasn't become doctor yet. We are on a pathway to become, yeah. But we are actually PhD students at Department of Health Sciences, University of York, and affiliated with a project that is actually focusing upon diabetes and depression in South Asia. So we have planned to arrange a workshop uh, for students that can provide a brief understanding of qualitative uh, concepts, concepts, and how do we do that? What is qualitative data? And without gaining more of your time, I would like to ask Karen to take a mic and start providing us your presentation.
Hello, everybody. Thank you so much for inviting me to join you today. I really appreciate the opportunity to talk to you all and for giving up your time at the end of your day as well. I'm going to try and share my screen if I can, because I've prepared a few slides. There we go. I'm just going to make myself disappear because I find it a bit distracting to look at myself when I'm talking to you. So I'm going to start with a brief introduction to myself. So I'm talking to you today from North Yorkshire, which is in the northern part of the United Kingdom. And I'm based at the University of York in North Yorkshire. Today I'm talking to you in the middle of the day here, so I know it's early evening where you are, but it's the middle of the day here, and it's rather cold, rather damp and unpleasant, but that's the way it often is in December in the UK. So a little bit about my research. I'm interested in using a mechanism called task shifting to address problems with access to healthcare in low resource settings, and particularly around the idea of being able to train generalist health workers to undertake tasks that specialists would normally undertake. And because of the nature of my research, because I want to talk to people, then I've become quite interested in doing qualitative research, because that's the best way to answer that kind of research aim. To gather numerical data wouldn't really tell me very much. So hence my interest in qualitative research. So when it comes to thinking about qualitative research, I think it's always quite helpful to begin with a quote to give you a definition, if you will, of what qualitative research is. So essentially what we're saying is that this nice short quote sums it up: the study of research problems addressing the meaning individuals or groups ascribe to a social or human problem. The key point is that we want to explore the viewpoints of the people that we're studying, and this introduces the idea of subjectivity. So this is something that's quite different to qualitative research, where you're looking at things in a much more quantitative way. You're measuring outcomes. just get this to move on. There we go. So if we just sort of perhaps do compare and contrast first of all. So with quantitative research, we're taking what's called a realist or positive approach. So we work from the assumption that there is a single answer to the question that we're trying to address. So we're looking very much at cause and effect. So if I give somebody a tablet, what would be the effect of taking that tablet? If I give somebody an exercise program to undertake, does it improve their stamina or their muscle strength, for instance? When we do quantitative research, we always try and control the environment as much as possible. So we're trying to get rid of the idea of confounding variables so that we can be confident that the outcome that we see is produced by the thing that we're measuring. And as part of that, we tend to produce results that are numerical in their format, so a percentage or some kind of number to give us an answer. Qualitative research is very different to that. So it's shaped by philosophical assumptions. So it's an inductive process, and we'll talk a little bit more about that in a moment or two. In qualitative research, we accept the idea that there are multiple realities. So there's more than one answer to a question. And again, we'll look at that again in a few moments. And we also use something called reflexivity. So this is kind of similar to bias, if you like. It's the qualitative version of bias in quantitative study designs. But whereas in quantitative study designs, we're doing everything we can to get rid of bias, in qualitative studies, we are accepting that the findings that we present are they're a combination, they're a collaboration between ourselves as a researcher and the participants that are involved in our studies. So we're bringing everything together. We're bringing everybody's standpoints, everybody's viewpoints, everybody's individual biases, and we're incorporating those into our study. And we present our results in a narrative format. So we tell a story or we present some themes to explain our research question. So, okay, let's think a little bit more about philosophical assumptions. So in my last slide, I said that qualitative research studies are shaped by philosophical assumptions. But what am I talking about when I say philosophical assumptions? So these are the guiding principles of qualitative research. Before I go any further, I just want to sort of think about why is it important to have philosophical assumptions. So these guide the direction of our research goals and outcomes, because how we as researchers formulate a problem and the research questions to study is shaped by our assumptions. These in turn influence how we seek information to answer our questions. Our assumptions are deeply rooted in our research training. They're reinforced by the scholarly community in which we work, which may, for example, have a preference for using a particular methodological approach or be interested in doing research in a specific field. For example, we might be working in a study area that's particularly interested in cancer care or treatment for mental health conditions. And when it comes to sharing the findings of our research, our philosophical assumptions are important in terms of, because we all have different philosophical assumptions, if we perhaps write a paper that we want to have published in a journal, if that journal is run by editors that have a very difficult philosophical standpoint to us, they may feel reluctant to publish our paper because they may feel that it's at odds with their own beliefs. Similarly, if we are, as a student, if your examiner has a very difficult philosophical standpoint to you, they may be really closely questioning you about the value of your research. So you will need to be able to talk about your philosophical assumptions and your standpoint in order to be able to defend the results that you're presenting. So I've introduced quite a few sort of jargony words there. So I think it's really important before we go any further to perhaps get to grips with some of this qualitative research jargon. Now, a lot of researchers new to doing qualitative research, or indeed, if you're reading a qualitative research paper, you can get quite put off or confused by some of the terminology that is used in qualitative research. And I think it isn't helped by the fact that qualitative research is drawn from lots of different disciplines. So social sciences, for instance, or psychology. And each of these disciplines has its own preferred language. So there's no agreed terminology in qualitative research. And you may come across different terms which are actually being used to describe the same phenomenon. And sometimes you come across a term that's actually being used to describe different things as well. So it can be quite confusing at first. So I think if I introduced 4 basic assumptions and explain them quite briefly, I think it's a really good starting point. But I think you will find that the more papers you read, the more you read about qualitative research methodologies, the more confident you'll get in using those terms, and things will start to make more sense to you. Okay, so let's have a look at these 4 assumptions. So the assumptions that I'm going to introduce to you today are the ontological assumption, the epistemological assumption, the axological assumption, and the methodological assumption. So they're all quite difficult to say, and I think that in themselves puts people off. So I'm going to start with the ontological assumption. And you might be thinking straight away, why is she showing me a picture of an elephant? But more about that in a moment. The elephant is going to help us to remember what ontology means. And as they say, an elephant never forgets. So ontology is all about the proposition that each of us interprets reality in our own way. So for example, we're all attending a Zoom gathering together right now, but each of our experience of doing so is different. So as I've already said, for me, it's the middle of the day, and I'm feeling under pressure to help you get to grips with qualitative research. For you, in Pakistan, it's the end of the day, and hopefully you're feeling fairly relaxed. You might be thinking about why I've put an elephant on the slide, or even about what you're going to be doing after the call. But what you can see is that each of our versions of the reality of this Zoom gathering is different, but each is equally genuine, and each is an equally real version of the same thing. So to bring you back to the elephant, if you were to imagine a group of novice researchers who had never met an elephant, never seen an elephant, have no concept of what an elephant could be other than knowing that it's an animal. If I was to blindfold that group of individuals and take them to an elephant, perhaps we'd go and visit a zoo and find an elephant. If I led each person up to a different part of the elephant and asked them to touch that part of the elephant and describe what they see, then each person would have a very different concept of what an elephant might look like. So the person touching the trunk at the front would perhaps think that the elephant was a sort of snaky-like creature, but the person touching the elephant's tummy and the person touching the elephant's leg would have a completely different concept of what an elephant would be like. Each of them is right, but each of them has a different idea of what that reality could be. The next assumption I'm going to introduce you to is the epistemological consumption. This is probably the hardest one to get your head around. It's and also the hardest one to say, I think, and that tends to put people off a little bit. But this one is all about the nature of knowledge and what counts as knowledge. So within the epistemological assumption, conducting a qualitative study means that the researchers try and get as close as possible to the participants being studied. By conducting studies in the field, or is sometimes referred to in the naturalistic setting, where participants live and work, the researchers are exposed to the context that help them to understand what the participants are saying. So this is how knowledge is known, through the subjective experience of people. Now, we're not going to say too much more than that at the moment, because as Mujib talks to you in a few moments about different study designs, you'll be able to see how the epistemological position of the researchers is slightly different with each different study design. So the next area we're going to look at is called the axiological assumption. And you may also come across it as being called positioning, or what is the position that the researcher adopts. All researchers bring personal values and biases and standpoints to a study. But unlike in quantitative research, where everything is measured numerically and personal values and biases play no part in the research process, qualitative researchers make a point of sharing their values and biases with the reader. This is called the Axiological Assumption, and it characterizes qualitative research. In a qualitative study, the researchers admit the value-laden nature of the study and actively report their values as biases, as well as the value-laden nature of the information gathered from the field. Among the aspects that you may see reported are the researchers' gender, age, their social position, their political viewpoints, and their personal experiences relative to the research area. So, for instance, I mentioned at the beginning of today's session that I'm a researcher based in the north of England. I'm also a health worker, and I work for the NHS, which is the National Health Service here in the UK. And I'm a clinician, and I specialise in the areas of chronic pain management, arthritis, and mental health. Now, if I'm doing research that involves any of those areas, then I bring that knowledge, that experience, and my perceptions and views about those areas of healthcare into the research, and that becomes part of the research process. So the final assumption that I want to introduce you to is the methodological assumption. Now, when you're reading research papers or talking about research, qualitative research, you might find people talking about methodologies and methods. And sometimes they do get confused, and it's not always clear when you're reading a paper what methodological approach the researchers have adopted. And they may talk about methodology when they're talking about the methods that they've used, okay? But they are actually quite separate things, and they're not interchangeable. So a methodology is the overarching assumption that drives what methods for gathering information and analysing that information are appropriate for answering the specific research question. So if you like, that's what goes with what. Okay, so for example, in grounded theory is a methodology, and grounded theorists use a specific method for collecting and analysing information called theoretical sampling, whereby they gather some information from the field. Typically, they might go out and conduct some interviews with some participants. They then go away and analyse that data. Once they've done that, they'll go back into the field to gather some more information, so carry out some more information and take that away and analyse it. And that process continues until they reach a point at which they feel they've answered the question that they're looking to answer. Now, this is a very specific method that's used in grounded theory, and it's not a method that you would see for gathering and analysing data or information gathered in other study designs, for instance, say a phenomenology. And again, I don't want to say too much at this point because Mujib is going to be covering this better in a few moments as he introduces some of the different qualitative study designs. But just to help you remember the difference between methodology and method, here's another analogy, and this is why I've shown you a picture of somebody doing some food preparation. So the methodology is, if you like, a style of cooking. So for instance, vegetable cooking, or bread cooking, or dessert cooking. And the methods are the approaches that are used within that methodology. So that would be things like recipes for making vegetable dishes like a vegetable biryani, or making a bread type of bread like a naan bread, or making a dessert like a kheer. So you can see that the methods help you to make vegetable dishes, or bread dishes, or dessert dishes, but they're not the style of cooking themselves. So methodology is the style of cooking, methods is the recipe. Okay. And I think that's all I want to say about methodologies at the moment. There will be an opportunity to ask questions towards the end, and I'm happy to discuss any of those with you. But just before I move on, I just want to mention sources of qualitative data. So we've talked about gathering information from the field. The most often used, I think, approach to gathering data when you're undertaking a qualitative study is the interview. So that can be either a face-to-face interview with one individual, or indeed you might conduct that interview over the telephone, or you might use remote access technology like a Zoom call, or a focus group discussion where you invite a group of individuals along and you interview them together. So your focus group might be made up of individuals who are all the same. So you might be talking to a group of patients or a group of clinicians or a group of policymakers, or you might choose to have a mixed group of participants in your focus group discussion, and you have a discussion about a particular topic, and that's a way of gathering data. So those are the two most commonly used approaches for gathering data in qualitative studies, but there are a number of other approaches that you can use as well. So a number of other methods for gathering data. So if you're an ethnographer, you might want to be observing people going about their daily lives. So you might be interested in understanding what happens when people are attending an outpatient department, for instance. So you might position yourself in the outpatient department and just observe what people are doing and just take field notes. So you're not asking anybody any questions, you're not interacting with them in any way, but you're observing what they're doing and how they interact with one another. You may use photographs or videos, so that might be you taking a video or taking a photograph, or you could be asking your participants to take photographs of things that they're doing, or you could be watching videos or collecting photographs from other sources. You might use diaries, so that could be something that you ask your participant to keep for you, and then you later go away and analyse what they've written in the diary. Or indeed, it may be a diary that you're keeping yourself, or you might be writing reflective memos to yourself. So again, they come within the different methodological approaches. You could be analysing data that you've obtained from documents. So that could be looking at policy documents. So it might be policy documents in an institute, it might be government reports, it could be something like patient notes or educational records. You could also be gathering data from social media. So you could be looking at what people are tweeting, what they're posting on forums, what they're putting on Facebook or Instagram. So that can be text, or it can be videos and pictures as well. Or you may be gathering data from textbooks or historical documents. So there are lots and lots of different ways of gathering data, and all of those can be analysed as part of a qualitative study. So I think that's probably all that I want to say at this point. So I think it's a good time now for me to stop and hand over to Mujib, and then after Mujib's spoken, I'm going to talk to you a little bit about reflexivity, and then there'll be some time for questions after that. Okay, so I'll just stop sharing my screen.
Thank you very much, Karen, for a good introduction to qualitative data.
Yeah, I'm just having a little bit of a job getting rid of my sharing my screen. Can you still see my share?
Yeah, no problem. We can.
Yeah, let's just see how we can get rid of that. There we go. That should do. Okay, over to you, Mujib.
Yeah, thank you. So just I have introduced myself in the beginning, but just quickly going to introduce myself again because few new people have joined us. That I'm Mujib and doing PhD from University of York, Department of Health Sciences. And today I'm going to speak about some topics that haven't been discussed in detail while we have academic discussion. So the idea is to give an introduction and overview of the things which haven't been discussed more often while we are being in academic settings. And uh, uh, that is the methodological approaches in qualitative research and how we design a qualitative research. Now, I'm not saying that in academic settings, you are not taught about how to design a qualitative research, do a data analysis. But while I discuss with students, uh, some students might have difficulties in dealing with difference between methods and methodologies and different kind of methodological approach, as Karen was trying to differentiate between what do we refer as methodology and how we can differentiate from it from method. So as Karen have given a introduction that what is qualitative data, qualitative research, I will talk briefly about that, where to start and how to do and what to do. So as we all know that any research question in scientific investigation starts from formulating a research question. And that research question has to be framed within the context of existing knowledge and understanding. So you have an understanding of literature, what has been done, and you try to frame a research question because you want to know something new that hasn't been properly addressed in the previous literature or research. And the next thing you consider is that, so what, why this research question is important. So if you are spending your time, your skills, and sometimes even a large amount of funding, then you have to consider that why this research question is important. There are two things that you have to consider in mind: how it will contribute or how it will increment in the knowledge. There will be a, can you, Mike? Bilal, can you unmute him, Faisal? So, sorry. So why this is important, you have to consider it. The one thing is that you have a background knowledge, understanding. You have to consider that how it will increment, it will increase the level of knowledge which has been already done. And this is very important thing. The other thing is how it will be beneficial for whatever the targeted population is. In healthcare setting, you have to consider that if it is an intervention, how it will influence or change the health practices, how it will be beneficial for the policy making. So you have to clearly lay out the benefits it will deliver. The next thing is considering the philosophical and theoretical position. This is where I would say that majority of the people will, as Karen was saying, that will get away from qualitative research. But it is, I would say that it is a better idea to stay with it and try to understand as much as you can. So philosophical theoretical position is that what is the underlying assumption you had in mind? What are you trying to do? For instance, if are you trying to, for in a very simple manner, are you trying to look forward to have a more generalized phenomena? So yes, you will be more inclined toward a quantitative research. Are you, in a way, are you seeing a reality in a more objective manner, in a more measurable manner? then this philosophical position will drive you towards a quantitative approach. While if you assume that there are multiple realities, as Karen mentioned, and myself can have my own reality of anything, I can think differently from what the other person is thinking. So here your research question is, your assumption is more oriented toward a qualitative approach. So it depends upon the research question and its underlying philosophical or theoretical positioning, that whether this research question is qualifying for the qualitative researchers or not. And if it is qualifying for the qualitative research, then you will consider about the qualitative methodologies, qualitative method, and I will talk about the qualitative methodologies in a bit more detail in coming section, which is the basic purpose of today's webinar from my side here. And you have to consider the qualitative methods of data collection as well, like focus group, interviews, participant observations. You have to consider the sample, which is called as a subset of a population, the set of a population from where you are taking, how you will approach them, how will you will recruit them into the study, how you will collect the data with focus group or interviews, from videos, as Karen was telling, from tweets or social media. And you also have to consider the stakeholders' involvement and ethics to protect the human rights while they are being involved in a research. Stakeholders' involvement mean that what public thinks, for instance, what public thinks about your research, is it going to beneficial? What are the things in the mind of the public that might facilitate your research, that can inhibit the objectives of your research? So it is to involve the community, and if you're specifically talking about the healthcare setting, to involve the patient and policymakers into your research. Considering the role of theory, now this is also a bit struggling point. So in qualitative research, sometimes if we are investigating a research question, then there might be some relevant theories relating to this research question. And what we try, instead of generating a new theory, instead of generating some new ideas and theories and building on it, we take already existing theory and we try to fit our data in the context of that theory. So while designing a qualitative research, you also have to consider the relevant theories which exist in the literature. Although it is not a compulsion, in generally most of the time, especially in Pakistan, what I have observed is that they utilize a more pragmatic approach without utilizing any theory or any theoretical positioning. Promoting the quality of in the design, and myself and Karen was performing a quality assessment of studies, and we find out that very few studies have addressed the issue of reflexivity. And reflexivity is I would say that it is the essence of qualitative research. If you're claiming that qualitative research is a scientific investigation. So Karen will talk about reflexivity in detail, but briefly, I would say that reflexivity is how the expectation and settings and things related to researcher can affect or bias the findings which you will get at the end. So you have to be reflective during the whole process and be aware of any factors that can influence the finding that are related to research. Karen will talk about it in more detail. And the last thing is, while you have considered all of the things, it is a good practice, even if you are not doing a PhD or MS, you still have to write down your plan of doing qualitative research, what you will do. So this is called as preparing a protocol, and it is equivalent to the term which we utilize in academic setting, that is study proposal. So I have quite often I have seen that I have submitted my proposal, I'm getting late. So study proposal and protocol is used as synonymly. So here it is referring to word qualitative protocol, qualitative research proposal. So you have to write it down at the beginning. So this is a bit of introduction of overall orientation of qualitative research. How do we do that? And what is the underlying process? Now, moving towards the methodologies. Now, let me tell you a few things before going on to the methodologies, that it isn't necessary in qualitative research to use any methodology. I have observed and heard my one of the senior who was saying that methodologies have been used as a convenient labels. So we use them and we don't know that how to use them and what that actually mean. So if you don't know the basics of methodologies, and you don't even know the practical issues, you don't use them, because without referring to them, you can develop a qualitative protocol. You can mention that how you will collect data, how you will take sample, and you can develop a whole protocol. And in majority of cases in healthcare research, it is a pragmatic research without considering any kind of methodology. But still, as a belonging to the field of social sciences, it is a good thing you have a good understanding and even have an introduction to such to methodologies which we use in qualitative research. So what is methodology? I would take a bit of time here trying to describe. So methodology is actually assumptions, underlying assumptions. In Urdu we called as marfuza. एक marfuza होता है, underlying assumption, that affect or influence the whole process, especially sampling, data collection, and analytical approach like analyzing the data. It influence and shape the whole process. So for instance, we have a research question that what are the, how do people express isolation during the depression? So here assumption is that we are focusing on the experience of individual, that how they express isolation. So the underlying assumption is that we are focusing upon the experience of individual. There is another question, for instance, how do people experience isolation in a Native American society or in remote areas of Punjab? Now, here we are focusing upon the individual experiences within the social and cultural context. So there is a differentiating aspect. At one question we are focusing, and we have assumed that we are focusing on individual experience. At the other side, we are focusing on individual experience within the social and culture context. So these research questions have two different kind of assumptions. And you will see in coming section that these different kind of assumptions will shape that how do you collect data and how do you analyze it and how do you report it. And there are many methodologies I have mentioned, but the famous methodology, especially in the context of healthcare research, is phenomenology, ethnography, grounded theory. We'll go into the detail in next slides for these three methodologies. So starting with the phenomenology. So it focuses upon the phenomena to be explored. So phenomena can be an abstract or tangible idea such as professional, even isolation, grief, caring relationship. So the concept or the phenomena can be referred as a concept or idea, and that phenomena has to be experienced by a set or group of people. For instance, if we are talking about grief, which is a phenomena and can be referred as an idea or concept, so it has to be experienced by the group of people. And phenomenology is actually focusing on the exploration of that phenomena who which is experienced by the people. And the second most important thing of the phenomenology is that it focuses on the lived and subjective experience of the individual. So how do individual with grief live their lives, and what are their personal experiences? For instance, what are their experiences while they are being hospitalized? So there is a phenomena, and the other thing is subjective experience of the individual. So these two things are integral to the methodology of phenomenology. And because the purpose of phenomenology is to focus on lived and subjective experience, researcher tries to bracket himself or herself out of the study by focusing and discussing the personal experiences relating to the phenomena of the individual. He is trying to, or she is trying to bracket himself out, step outside, and let focus on the experience of an individual with a certain phenomena. For example, experience of people suffering from depression on a certain phenomena, that is isolation. So, and what researcher is trying to do is to see the experiences through the interpretations, through the mindset of, or you can say through the eyes of that person. So it boils down to the four steps. I mean, four things: that there is an object, that phenomena, how person attribute meaning to that phenomena, how do he or she analyzes that phenomena in through mental processes, how do it relates to social context, so to other people, to his home place, and how he responds to that, uh, how he responds on that phenomena. So important to know that individual and phenomena hold a central position in phenomenology. Social context only assumes meaning as an expression of individual. Social context means that the interaction, that how do people sees other people and hold opinions about other, is only relevant that how that individual construct the social reality of other people. So how others people view himself is not relevant to the phenomenology, and that is which point which differentiate uh, uh, other approaches such as ethnography from phenomenology, because in ethnography social context and interaction holds a central position. We'll discuss in coming section. So how do researchers focus on phenomenology? Focusing on phenomenology, collect data, typically involve in-depth interviewing individuals who have experienced the phenomenon. Now, interviewing is a data collection method. And I told earlier on that methodology is an assumption that will shape or that will shape the process of data collection, even sampling and data analysis. Now here you will see that in majority of the studies related to phenomenology use in-depth interviewing. Why? Because if you want to understand the if you want to dig into the experience of an individual, you can't do a group discussion. In group discussion, a person might be feeling concerns about confidentiality, and he might not be open as much as he can feel openness in one-to-one, face-to-face, in-depth interviews. So, so here is a clear example that how methodology, the underlying assumption of a question, has framed or has shaped the process of data collection. So typically involve in-depth interviewing. However, some phenomenological studies involve varied source of data, such as poems, where individuals often express the personal experiences related to different kind of phenomena, observations and documents. And data analysis focuses and interpretation focuses on what and how individuals have experienced. So again, the data analysis is focusing upon the experiences of an individual. I have an example in front of you. So that is a study that says cognitive representations of AIDS, a phenomenological study. So the phenomena here is the AIDS, people suffering from AIDS, and how they represent, cognitively represents the concept or the phenomena of AIDS. So this is the focus that is orienting, that is actually orienting the focus of the research, the orientation of the research toward phenomenology. And you can see that it's focusing on personal experience, and they have conducted 58 in-depth interviews. So there are a few cues, few assumptions which will shape this process. Now coming towards the ethnography. So it is originally developed by anthropologists as a mean of understanding and making sense of cultural values and normative assumptions. Now you're seeing a significant change, that how we are moving from an individual experience towards a more socially integrated context. So it is, phenomenology is not unlike phenomenology, which is focusing upon the individual experience. Here its focus is upon the cultural, normative values and social context. And what it do, it tends to describe and interpret the shared and learned patterns of values, behavior, beliefs and language of a culture group. Exploring the interpretation of social reality through individual practices, perspectives, views, and experiences are common to all qualitative research methods. But how ethnography differentiates from other qualitative approaches is that it tries to understand the perspective, experience, and reality within the social, interactive, normative, and cultural context. That is the few keywords which differentiate ethnography from other approaches. You will get a good understanding while I will do a follow-up discussion. I'm struggling with changing the so what ethnography is saying, that individual exist as a social being and as a part of society, and we cannot interpret reality as we want. There are people around you. There's a whole social context. You have to realize the active agency within the social context. So it is important that who think you are, but it is also important that how other views are in defining you, how other sees you. So it interest in how values and norms become internalized, legitimized to the process of social interaction. Let me take you to the most basic question in ethnography from where it has been emerged. How is society possible? How people get involved with each other and develop and internalized norms and values. So this is a very basic question that is related to ethnography, because whenever interaction come into action, there will be, the situation will become complex. There will be some norms, there will be some values, there will be some shared cultural beliefs. So it is concerned with with the the two things, agency and structure. Now, agency refers toward the personal freedom, free will. At the same time, you want to do something, but there is a social structure which will facilitate you in doing something and which will inhibit you in doing some other things. So it becomes a more complex, interactive interactive environment in which ethnography research has to be take place. So how do ethnographers collect data? Generally speaking, usually ethnography involves extended observations of a group. Now see how, again, how methodology has shaped the way of data collection. When you are focusing on individual, it would be a better way to focus on individual and do a face-to-face in-depth interviews. But if you want to know about the normative practices, if you want to know about the interactive nature of some community group, you have decided what do researchers do. They tend to immerse themselves into the community, into the culture, and take and they observe people around them as a participant of that community or group, and they do observe people and interview the group participants as well. For example, this is a study, and the authors of this study focuses upon the group's culture representation of Islam, the Muslim community, being a young Muslim, changing culture context. Now, I don't have more time to go into the detail, but just read the abstract and see that how words such as cultural conditions, ethnicity, religion, community are apparent in abstract and research focus. So the idea here is that while you're drafting a research question, if the underlying assumption in your research question revolves around the our interaction is a central position in your research question, then its orientation will be toward the ethnography. And how authors in the study position themselves by mentioning their involvement in social community, their role as a participant observer for 3 years group, and life history interviews. So so see how the concepts related to interaction, like cultural conditions can't be possible without interaction. Ethnicity is a group of people, religion, community. All of these things hold the same concept, that is social context. And now coming toward the last methodology, that is grounded theory, which is a bit of different from phenomenology and ethnography. So here focuses on the process or on action. So common example are how do we manage common mental illness, how to become how to support a faculty to become good researchers. So in grounded theory, the focus is upon the process. If you are trying to uncover some process, then it will be more inclined toward grounded theory. And another key aspect of grounded theory is that at the end, you're trying to end up with developing a theory, and theory are the explanations of a phenomena, as you all know if you have studied. So you end up with the development of a with the development of a theory, and you use memoing. What is memoing? While collecting the data, you jot down the ideas that how do you explain the phenomena, how do you explain that what is going on, which will at the end of the day can be a part of theory, or which is actually a pathway towards making a theory. And these ideas, as I mentioned, tend to formulate the process which will at the end might become a part of theory, which you are taking during the data collection. So what do researchers do in grounded theory? Typically involves interviews. I have seen that some of the studies also take focus group discussions as well. And one thing to note here is that grounded theory is an iterative process. It is the process of going forth and back and gathering new interviews. So for example, you have taken 2 interviews, and you have checked the data, and you saw that some new thing is emerging from my data and I have to clarify it. Then you again go and take another interview relating to that, and then you again emerge some ideas, and saturation is the limit, that when you comes at the stage that no new idea actually emerge out of the data. So at the same time, you are comparing the different data from one person to another person. This is called as constant comparison. You're comparing the new data to the old data, and you are actually involved in a more inductive approach. What does inductive approach mean? Inductive approach means that you are taking the themes or codings from the data. You haven't defined any pre-existing themes or codes, and you're trying to fit your data into that. So for instance, if there is a statement in a qualitative research, you will try to develop a theme out of that data or out of that statement, rather than if you have already a pre-existing theme or code, and you're trying to set your fix your code into the your data into that code. And open coding is similar to that you do coding and your coding emerges from the data. I will try that if at the end I have a chance to give you a bit of a demo regarding to it. So actually open coding means that your coding will be grounded in the data. Yeah, it will emerge out of the data. So example, developing a long-term physical activity participation, a grounded theory study with African American women. Now, the central focus here in this study is to understand the behavioral process, that how do they they participate in physical activity, what are the flow of the process. And a theory emerged relating to physical activity evolution for the African women in the study, and they conducted the face-to-face interviews. So again, these key themes which are relating to grounded theory are actually differentiating this are highlighting this approach in this paper. So these are the key references. If somebody wants, he can contact the organizer and take the slides. And now I would like to hand over the session back to the Karen.
Hi there. I just want to check how much time have we got left, Mujib?
I presume 20 minutes to half an hour, maybe.
Okay. Okay, I'm just mindful that people might want to ask some questions. I'm just going to try and share my screen again. I've just got a couple of Reflexivity slides that I can maybe pop up. There we go. Okay. And again, just a couple of definitions there, a couple of quotes to help us think about reflexivity. So reflexivity is all about, as I say, it's a collaborative process. It's where we're bringing together our subjective viewpoints with those of the participants from whom we're gathering information. And as a, if somebody's reading our research, I think, our readers have a right to know about us, so they need to understand, why we're interested in the topic that we've chosen to investigate, who is our audience, and what's in it for us, why are we particularly interested in this area of study. And it's really important that we reflect upon the knowledge that we produce and our role in producing that knowledge. So how have we influenced, how have we chosen what findings we decide to present and what interpretation we put on those findings. So when you've been reflexive, there are two types of reflexivity that you want to think about. The first one is what we call functional reflexivity, and the second is what we call personal reflexivity. So when we're talking about functional reflexivity, we're very much talking about the process of doing research. So when Mujib talked about developing a qualitative research protocol, in the protocol you're going to specify which methods you're going to use for gathering your information, for gathering your data. Now, as the slide that I showed you earlier, I showed you there are different types of data that you could choose to sample from, different sources of information that you can use. Now, if you're just thinking about your research question, if, for instance, I was interested in doing some research about people's conceptions of body image, for instance, if I was to choose to gather my information through a focus group discussion, bearing in mind that body image can be quite a personal thing, it can be quite emotive, it's very subjective. The kind of information that participants might choose to disclose in a focus group discussion about body image, you could see that that might be very different from if I decided to gather my information through asking people to keep personal diaries. So I might be studying a group of individuals who have some, who are struggling with their body image, for instance. I might sample, say, young women or young men. The kinds of data that they are likely to share with me, the kind of information that they're likely to share with me, could be very different in a personal reflective diary, which is a very private thing, to the kind of information that they might choose to disclose, or the way that they might choose to frame information in a focus group discussion. So you need to think about, what it is that you're interested in finding out about, and thinking about the best kind of method to help you to gather that information. Okay. The other type of reflexivity is called personal reflexivity, and we've really already touched upon that when we talked about epistemology and positioning. So it's thinking about what you bring to that research, how you as a person shapes and influences how that information is analysed, how it's dealt with, how you choose to present your findings. If, for instance, I was interested in perhaps understanding how a group of clinicians have coped with a hospital closure, for instance, and been reassigned to work in a different institution, then my experience of working as a health worker in the National Health Service in the UK is going to influence, to a degree, how I interpret the information that those health workers share with me about their experience. And I would want to report that in my study as well, because I would want the readers to understand that in some respects it's difficult for me to remove myself from that information, from from that experience, because it might be something that I have very strong views on myself. Okay. So you can see that undertaking qualitative research is very much a collaborative process, and that you're bringing together your own subjective experiences to those of your participants. Now, dependent on what kind of methodology you're using, how reflexive and how involved in your research you are, it could be, it could be really important. So if you're trying to use a socialist constructionist approach, your experience is absolutely enmeshed with the experience of your participants. If you're trying to do something that's quite removed. So I'm thinking here about, Mujib was talking about phenomenology. So in a phenomenology, you're very much looking at the experiences of a group of individuals. What is their lived experience? So you would probably want to try and remove yourself from that process as much as possible. In that instance, you would really be wanting to report your position, describe who you are, and try and differentiate yourself as much as possible from the group of participants with whom you are working. Ways to do that are, by keeping reflexive memos and just making sure that you're not being drawn into the data that you're analysing too closely, that you're not relating yourself to it too closely, that you're not placing too much emphasis on your own experience at the cost of the experience of the participants, so that everything is written from your viewpoint rather from the viewpoint of the participants themselves. You can also address reflexivity if you're working in a research group by sharing and talking about your interpretations and your experience. So you can check out, if you like, with your fellow researchers that your own viewpoint isn't taking precedence over the viewpoint of the participants from whom you're gathering information. So you can check things out like that as well. So you can look out for that when you're reading a paper. First of all, what's the methodology? Is it a methodology where the researchers working really closely with the participants, in which case you wanted to see evidence of the researcher bringing in their own experience into the interpretation of findings? Or is it a type of research where the researchers are looking to try and distance themselves a little bit from the research participants, in which case you'd be looking for evidence of researchers talking to one another, or maybe checking things back with participants as well. So they can do something called member checking, which is where perhaps you take a transcript of an interview, for instance. You might do some analysis on that transcript. You might draw some conclusions about what is being shared with you in that interview, and then you might go back to the interview participant and said, I think this is what you're telling me about, is that right? So you can check and you can make sure that you are not, you're not putting too much of your own interpretation on what they're telling you. Okay, so I hope that makes sense. If I hand you back to Mujib now, and then stop sharing my screen, and then perhaps we can maybe take some questions.
Yeah. So thank you very much, Karen. You would be seeing the reaction option in the Zoom. So you can raise your hand, or you can simply unmute yourself to ask any question. If you're feeling shy to ask in English, you can, आप उसे उर्दू में भी कह सकते हैं, मैं उसे इंग्लिश में फिर ट्रांसलेट करके बता दूंगा. I was saying, Karen, that if anyone wants to ask question in Urdu, I can translate it to her as well. So
Yeah, you can also type things in the chat box if you don't want to speak, or if your audio is not very good at the moment.
किसी का है कोई क्वेश्चन पूछना चाहता है कोई? हाँ जी, अनम्यूट करें अपना.
Sir, can I ask question?
Yeah, sure.
Thank you, sir, for your presentation and lecture. Sir, I want to ask how to quote the focus group discussion quotation in qualitative research.
Karen, would you go ahead?
Yeah, I'll take that one. Yes, so if you've got focus group discussion, you've got a couple of options. You can either summarize what people have said. So people in the focus group talked about this subject or that subject, or they had this viewpoint or that viewpoint, or you can just take a single quote from a single participant in the focus group discussion, and you can just write it verbatim in your write-up, and just put an identifier, an anonymized identifier for the focus group participant. So it might be focus group participant 1 or something like that. So you can quote an individual quote or just summarize. Yeah, we've got another quote here from, I think it's Miriam. Could you please elaborate more about grounded theory? Do you want to take that one, Mujib, or would you like me to take that?
Yeah, you take it, because I have mentioned before, so you should.
Okay, yeah. So very briefly, grounded theory is where you're looking at perhaps a new process. An example might be, you might want to study how a group of nurses have adapted to being moved away from their usual working environment on a ward to, let's say, they've been redeployed to work in an intensive care unit to look after seriously ill COVID patients. So it's a whole new process. Those nurses are working in a new environment, and you're looking to research how that's gone, because you're looking to develop maybe some protocols for how nurses are relocated from one area to another in the event of medical emergency like COVID. So a grounded theory is a really good approach for doing that kind of research, where you're looking at something's a new process. So it's an area where there's no pre-existing research about that. So Mujib mentioned an area where there's no existing theory. So we just want to know how best to support people who are in that situation in the future. So that's maybe when you would choose grounded theory. So grounded theory, as I say, is very much about finding out as you go along. So it's a little bit different to other types of qualitative research, where you may set out a specific period of time where you're going to, let's say, interview all of your participants, and you're going to ask them the same questions using the same topic guide. With grounded theory, you'll maybe find some nurses in the intensive care unit, and you're going to ask them some questions about, what's it been like moving from your ward to the intensive care unit? The questions are quite general, because you want to find out from them what the experience is like. So you haven't got a set number of topics that you want to talk about in advance, because you don't know what that experience is like for them. So those nurses are going to tell you a few things about how it's been from moving from their ward to their to the intensive care unit. You'll take that information away, you'll analyze it and look to see what comes out of it. So what you might find is the nurses are telling you that actually what was really difficult about moving from my general ward to the intensive care unit was I'm not used to looking after people who are really, really sick. Or it might be it was really, really difficult to wear the personal protective equipment for a whole 12-hour shift. So you might take something like that and say, well, that's really interesting. I hadn't really thought about a nurse moving from a general ward to an intensive care unit might struggle with looking after people who are really seriously ill, because perhaps the ward they worked on before, people weren't particularly ill. So then you might go back to the ward and interview some more nurses about looking after people who are really seriously ill. What's that like? And ultimately what you might get out of that is you might be making some recommendations for ways to prepare and support nurses in looking after seriously ill patients. So that wasn't what you thought you necessarily would be doing at the end of the study when you started the grounded theory study. But the grounded theory study is about finding out what's the really important part of that process, and what do I need to do in future to help nurses in that situation. I hope, does that help?
Okay. Asim, can you unmute yourself and ask the question?
Right. Well, thank you, sir. I have a question with Karen. So Karen, in the introduction, you explain about the qualitative research, right? So I just want to ask that, is that qualitative research is as empirical as, and the authenticity as in the quantitative research is the same authenticity we can get in the qualitative research? Because, while doing the qualitative research, as we have learned that we can have a naturalistic environment. The researcher who's conducting the research, he can be a biased in that setting, right? So both the things are not in the quantitative research. So can you elaborate how we can minimize such things? Thank you.
Yeah. Okay, I'll do my best. In quantitative research, we're very much interested in absolutes, and that's what I meant by a realist or positivist approach. There's only one truth out there, that if you do this to that, you're always going to get the same answer. Qualitative research, because it's subjective, people can feel quite uncomfortable about that and just, is there a right answer? Is there a wrong answer? Well, the answer is there are no rights and wrongs in qualitative research. It's all a matter of interpretation. And this is where I mentioned having different philosophical positions. So when I mentioned that you might submit a paper to a journal, but if those authors have a very different philosophical standpoint to yourself, that they may not feel that your study is valid, contributes anything to the literature. So it's about opening up dialogue between researchers and the community in terms of, sharing knowledge. What is the value of knowledge? So, and this recognition that everybody's experience has validity. So, my experience as a patient on a ward is just as important as the experience of the doctors and nurses who are working in that ward. So how I feel about what time I don't know what time the ward staff, the nurses, like to wake people up on the morning to start the day. So on a ward, things are often run in terms of the nurses like to get patients up and ready for the day because they want to run the drug round at a particular time. They want to hand out all the medications so that they've got time to do their handover to the next shift coming in. Well, that might not suit me as a patient. I might not be very happy about being woken up at 6:30 to have my breakfast because the nurses want to give me my medication at 7 o'clock before they then go home at 8 o'clock in the morning. So if you were to ask nurses about what's the best way to run a ward, they might tell you one thing. If you were to ask patients about what's the best way to run the ward, they might tell you something different. But both of those viewpoints are correct. They're equally valid. So that's what we mean about subjectivity. It's not like quantitative research where we're looking to control all the variables so that we always get the same answer from the thing that we're testing. I hope that answers your question.
Yeah, Abdul Bari, can you unmute yourself and ask us?
Thank you for providing the excellent opportunity about the qualitative research. I have a question. Can we use two research methodologies, qualitative research methodologies, in a single study? For example, I want to know about or explore about a philosophical assumption, and I want to know the both viewpoints, as personal viewpoint and as collective society viewpoint, in a single study. So it is possible?
I would say so. I think it's how you report your findings, how you present them, just making clear what's your own viewpoint and what's the collective viewpoint.
Thank you very much.
Thank you. Karen, Baha has asked that how to identify the people in transcription during the focus group discussion, and when later a person withdraws from a research and wants his or her data deleted from the FGD. How can we deal with it?
Okay, I think in terms of people withdrawing from a study and who has ownership of the data, I think that really comes down to the consent at the beginning of the study. I think once people have provided data for a study, it's very difficult to extricate that data. So I think it's more a case of when you are preparing your patient information materials and your consent form, that you make it clear that people can have the right to withdraw from a study at any point with, there's no comeback, nobody's going to ask any questions or try and stop them from withdrawing from the study. That's absolutely fine. But in most cases, I think what generally happens is, as part of that process, you make it clear up front that any data that they've provided for the study up until that point remains in the study.
And the next question, can you briefly explain the case study methodology is? What case study methodologies?
Oh, I don't actually know too much about case study methodologies, if I'm honest. Do you know much about them, Mujib?
Yeah. So basically, case study methodology focuses upon the majority of the time, it focuses upon a single case. And so for instance, in some cases, you have observations that might deviate from the normative, you can say, normal observations. So in that case, the primary point to take away is that case studies generally focuses upon the single case. For instance, if it is a study on a certain patient, it focuses upon taking the history of that person, different the history can be related to different things, and to make a sense out of data. So it involves taking data from different sources. It can be interviews, it can be different documents relating to the person, like psychiatric history, medical history, and these type of things. So coming to the next question.
Yeah,
Bilal?
we've got a few, yeah, and we've got a
Well,
few questions coming up in the chat as well. Maybe
yeah.
we could take those after Bilal.
Yeah, Bilal?
Hi, Ms. Karen and Mr. Mujib. I am Bilal Ahmed, doing my job as a research assistant in Impact. Here, my question is that what is the difference between a project design with a qualitative paradigm and one design only to gather qualitative data?
Oh, I'm sorry, I didn't hear that very well. My audio is not very good. Did you hear that, Mujib?
Yeah, can you repeat the question, Bilal?
Yes, my question is that what is the difference between a project designed with a qualitative paradigm and one designed only to gather qualitative data?
ओके बिलाल, अगर उर्दू में मुझे समझा दो तो कुछ नहीं होता, मैं उसे इंग्लिश में ट्रांसलेट कर लेता हूँ।
जी जी, मुझे मेरा सवाल ये है कि एक जो हम रिसर्च करते हैं क्वालिटेटिव में, तो वो डेटा जो हम डिजाइन करते हैं क्वालिटेटिव पैराडाइम से, और दूसरा जब हम डेटा कलेक्ट करते हैं थ्रू क्वालिटेटिव, तो इन दोनों में डिफरेंस क्या है?
क्वांटिटेटिव डेटा और क्वालिटेटिव डेटा में?
जी जी जी।
Okay, so basically he's asking what is the difference between quantitative and qualitative data. So she has mentioned earlier on that quantitative data is actually, you are actually transforming the natural data into numbers. So you are asking someone, how much depressed are you feeling right now? You can give them options: 1 for not at all, 2 for a bit, 3 for a bit more. Yeah, but this is a quantitative data. So you have asked the question and the person is mentioning his answer in numbers. In qualitative data, that is a natural data. So you could ask that how do you feel depression? It is an open-ended question. So a person will ask, answer it in using the language that I often feel depressed because of loneliness, because I don't have job. So this is a natural data and the natural way of communicating with other people. So this is the difference between quantitative and qualitative data. Qualitative data is more is natural data, in-depth data, and it is really utilized for more exploratory purposes, while quantitative data is objective in nature, and it is being represented in numbers, as I told earlier on, and you can actually use quantitative data in most cases for generalization of findings. So yeah.
Shall we maybe take some of the questions that have come up in the chat as well?
Yeah. So the next question is, does we use any specific approach for interpreting the results from the data we gathered? What are these, as we use SPSS in quantitative approach?
Well, there aren't any software tools that will do the data analysis for you, but there are some project management tools that you software packages that you can use. So the most commonly used one, I think, is a package called NVivo, but there's also another one called Atlas, which is quite commonly used as well. And there are other packages too, or indeed you can organize data using Google Sheets or Microsoft Excel spreadsheets as well. So you use your software package to help you manage data, to organize it. So if you want to do some coding, for instance, you can use the software to assign pieces of text from, say, a document and put them under one heading. So, put them all together in one group, and then you can look at those groups and reorganize them so that you organize your data into what becomes known as themes. I mean, we haven't talked about data analysis today. We haven't talked about coding and thematic development. But essentially, those software tools help you to organize things, but they don't do the job for you. So that's quite different from in quantitative work, where you would use your software packages to actually do the analysis for you. They do the sums for you, if you like. Okay.
Just quickly, this is the last question. Actually, some of the questions which are saying that how do we analyze data in qualitative research? So just like in quantitative research, we have descriptive statistics, different sorts of statistical tools. So would you can briefly introduce about the thematic analysis and some strategies which we use in qualitative data analysis?
Yeah, so thematic analysis is irrespective of what type of methodology you used for undertaking your qualitative research, you're going to be doing some analysis of that information, that data. And generally speaking, what you're doing is you're looking to organize that data into themes, so into topics, things that are going to help you to address the research question that you have, or the research aim that you have, the thing that you want to explore and understand a bit more about. So in order to do that, you will convert all of your data into text. So if you've audio recorded an interview, for instance, you would transcribe that data into a text document, or you would attach a description to, say, a photograph, or if you are analysing, say, a video or a piece of film, you would add a text description of what's in that film, and you would transcribe the audio soundtrack of that film or video into a text document. And then you read that text document and you look for sections of text that seem important in terms of your research aim or question, and you code that. So I might be reading a piece of text where I'm looking at interactions between family members. So any piece of text that I come across, a sentence or two that, you know, where somebody said something that's to do with, say, their relationship with their brother or their mother that seems important to me, I would highlight that piece of text and I would give it a label. I would give it a name that maybe describes what I think is going on in that section of text, and that becomes a code. And I go right through all of my documents, highlighting pieces of text, giving them descriptive labels, codes, until I've finished going through all of my text. And then I'll have a look at all of the codes that I've collected, and it might be that I've come across several pieces of text that I feel fit under that same code, so I might gather them all together. And when I look at my codes overall, I may feel that, well, all of these codes here seem to talk about a particular topic, so I'm going to gather them together and they become a theme. And I might take another group of codes and gather those together under another theme heading. So it's just it's a way of organizing your data, and it allows you to develop some ideas that you can then present as findings. So that's a really, really quick and brief explanation of what coding data is. I mean, it's a big topic all in itself. I think you'd agree, Mujib, but is there anything that you would want to add to that?
Yeah, that's a good overview of comprehensive overview of qualitative data analysis. It is a big topic. Some people were requesting us to arrange another session on qualitative data analysis, thematic analysis. I would share a paper by Brown and Clark. Is it? Yeah, but they have quite comprehensively explained that how do we conduct a thematic analysis. So this is all from this session. We have tried to answer the question as much as we can, but due to time restrictions, we will end up here. If any of the people from organizing committee, maybe Faiza or Tayyab, wants to say something.
Yes, thank you so much, sir. Hope many participants got answered of their respective questions.
Yeah. Okay. So thank you very much, Karen, for giving us time and answering the questions and giving us a presentation. It was really nice to listen to you.
Thank you. You're very welcome.
Thank you so much.
Yeah. Enjoy the rest of your evening, everyone. Thanks. Bye-bye.
Thank you so much, Sir Mujib and Ms. Karen, for sharing with us such wonderful information.
Thank you, Father. Bye.